Hello guys, welcome to our today's discussion. In today's discussion we will be discussing about the ulna bone. The radius bone already has been described. You can click the description link below and you can browse for the radius bone. So when we talk about the ulna bone, it is also the bone of the forearm along with the radius. Radius takes the lateral part and ulna takes the medial part of the forearm as per the anatomical position. When we take the ulna bone, we can see the bone itself is divided into again three parts, as it's a long bone. The upper end and the proximal part, the lower end or the distal part, and the elongated part is known as the shaft. So coming to the upper end, if we see the upper end, we get a cobra shaped structure, and this cobra shaped structure is called as the olecranon process. During the extension of the elbow joint, the olecranon process slides over the olecranon fossa. Next, when we do the extension, the olecranon process comes out over the olecranon fossa, and now the next part, this is the coronoid process, which slides over the coronoid fossa. So this is the coronoid process of ulna, and coronoid fossa is found in the humerus lower end. It slides over there during the flexion of the elbow joint. Next, we have a part in the lower end of the humerus, that is the trochlea, and trochlea get attachment here, and this also takes part in the formation of an elbow joint, which is a hinge joint where we can do flexion and extension movement. So this area is for the attachment of trochlea, and this part of the ulna bone is called as trochlear notch. Next, we have seen here, this part is called as the radial notch, where the radius bone goes and gets the attachment to form a joint which is called as superior radio-ulnar joint. It's a type of an angular joint, and in the lower end, the head of the radius will join with the radial notch of the radius and form the inferior radio-ulnar joint. So together they are superior radio-ulnar joint, inferior radio-ulnar joint, and they help in the supination and pronation movement of the forearm. Next, we have the borders and surfaces of the shaft region. There are three borders. The first border is called as the anterior border. This one is known as the anterior border. Next, from the posterior side, if we come down holding the olecranon process, we get the posterior border, and then as this is the bone, this will have the interosseous border or lateral border. Why this is called as an interosseous border? Because these two bones will be getting attached by the interosseous membrane or interosseous muscles. Now, next thing is coming to the surfaces. This is the anterior surface between the interosseous border and the anterior border. This is the medial posterior surface between the anterior border and the posterior border, and this is the medial surface of the bone between the posterior border and the lateral border. So these are the surfaces. So revising again, the surfaces borders we have is the anterior border. Next, we have the posterior border and the interosseous border, which is also called as lateral border. Coming to the surfaces, anterior surface, posterior surface, and medial surface. So coming to the lower end, this is the head of the ulna. This is the only bone which has the head in the distal end or lower end, and this is a sharp projection which is called as the styloid process of the bone. So this is the medial styloid process, and this is the lateral styloid process. So again, to revise the joints, this is forming the ulnohumeral joint, which is a part of an elbow joint, helps in flexion extension movement. There we have two joints between the superior and inferior radio-ulnar joint, which helps in supination and pronation of the forearm, and these are the entire bones of the forearm. If you have liked the session, please press the like and wait for the next video.